My patients ask me, am I a candidate for a custom facial implant? Well, everybody's actually a candidate. A custom or a patient specific implant will always be best compared to a standard implant. Why? We're all slightly different in terms of the bone structure and the soft tissue structure. You combine both of those, and it's hard to have a standard implant that's going to be satisfactory aesthetically for all patients. So, the best thing to do is use a custom implant. How do we do that? Well, we do a three-dimensional CT scan. We take photos, front, oblique view, and side views. We morph those photos so we can take the photo and change it to show you an estimate of what you're going to look like. Using the more photos, the three-dimensional CT scan, we sit down with a specialist from 3D Systems through Implant Tech Associates, the only FDA-approved facial implant company to make custom implants. I happen to be one of the three uh, instructors at the cadaver course that we have annually for that. So, with that information, three different sessions, we then go with you with your direct input and we design a shape, size, and surface area of what you want to get the best aesthetic result that you're looking for.